Hi, my name is Garrett Sanders. I'm one of the pediatric dentists here at PDNO, and today we're going to talk about extractions and what having an extraction done looks like for your child. Without a doubt, one of the most frightening or stress-inducing procedures that someone can have treatment planned at a dental office is an extraction. And we're well aware of that, and we do our best to try to make that as pleasant and as gentle of an experience as we can, but we know that people have a lot of questions about extractions and what that's going to look like for their child, what their child is going to feel and experience on the day of the procedure. And so today I would like to explain that to you a little bit. So whenever a child comes in for an extraction, the first thing that's going to happen is we're going to do our best to provide profound anesthesia. Anytime you're removing a tooth, you want to get the tooth completely numb. And so that's going to be the first and most important step of the procedure. And we pride ourselves here at being able to do an excellent job of comfortably administering anesthesia in a way that the child hopefully is not upset by the experience and then is going to be comfortable during the following extraction afterwards. Once the anesthesia step is achieved, the doctor is typically going to give the child a decent amount of time to just settle, to watch a movie, to allow the tooth to become numb. And then whenever they return to the room, then they'll start the steps associated with the extraction. Frequently, the first thing that they're going to do is they're going to check around the tissue around the tooth to make sure that all of it is numb. We're going to ask the child some questions to try to verify that the tooth is numb. And when we feel confident that the child is ready to proceed, then we'll start to apply pressure to the tooth. Depending on the situation, some teeth are loose, so that may be a baby tooth that was getting close to falling out, or sometimes the teeth will have lost root and the tooth will be mobile. In those circumstances, sometimes it takes very little pressure to remove the tooth, and no longer has the dentist grabbed the tooth and then the tooth is already out of the mouth, and it's literally a matter of seconds, and the child perceives almost no pressure. And for those things, it's easy. And the dentist typically will have told you that that's how it's going to go, and the child and yourself will have been prepared for that. But sometimes the baby tooth still has full roots, or it could be a permanent tooth extraction. And in those circumstances, there'll be more pressure. A lot of people don't realize that before they fall out, baby teeth have very long roots. And if you have to have one taken out because of decay before it's ready to go, sometimes it does take quite a bit of pressure to remove them. The dentist is going to use different instruments to loosen the tooth, and they will walk the child through the sensation of pressure that they're going to feel. We're typically doing this with a mild touch. We're not overloading the child with pressure, and we're watching the child's response and trying not to give them more than they can handle. And we build the pressure up in a way that's tolerated until we reach the amount of force required to remove that specific tooth. Once the tooth is loose, the dentist is typically going to grab it with an instrument called a forceps, which in layman's terms looks a lot like a pair of pliers. They're going to grab the tooth firmly and they're going to rock the tooth back and forth. The child is going to continue to feel pressure. The doctor is going to be touching base with the child at this point, reassuring them that it's pressure, but also making sure that they're not feeling sharp pain or other sensations that would be inappropriate, that would indicate lack of anesthesia. And then after just a short amount of time applying that pressure, the tooth will come out. And for most baby teeth, the procedure is under a minute. And the child a lot of times doesn't even realize that the tooth has come out once it's already laying on the tray. So it doesn't have to be a super frightening experience. And for those children that the pressure seems like it's too much, we have great oral surgical personnel in town that we can refer to have teeth taken out with anesthesia. There are other options, but the majority of kids are able to tolerate it just fine. So if you find yourself on the brink of an extraction appointment with your child and you're uncertain or scared, and if you feel like we haven't been able to answer all of your questions today, please contact the office. We would love to put you at ease, to put you or your child in a place where you feel comfortable going forward, and to make sure you have a good experience.